And now, making biopsies better and a lot easier for patients with lung disease. That's what's happening at Jefferson Einstein Philadelphia Hospital.
Let's learn more about the technology with health reporter Stephanie Stahl.
Very cool technology. You know, instead of big incisions, doctors at Einstein are using tiny scopes with tips that freeze to do lung biopsies. And for patients, it means they get diagnosed faster and with no downtime.
Hey, Anne-Marie, how are you doing today?
Good.
Anne-Marie Francano says she's relieved to be feeling better after finally being diagnosed with interstitial lung disease, which is an inflammation and scarring of the lungs.
I was so sick, and I honestly didn't think I was ever going to be back to some kind of normalcy.
Difficulty breathing made her sick and weak, having to depend on a wheelchair and supplemental oxygen until she turned to doctors at Jefferson Einstein Philadelphia.
It was remarkable. Really remarkable.
Instead of a traditional biopsy, Anne-Marie had a minimally invasive procedure called a cryobiopsy.
We freeze inside of the lung for like 3 to 4 seconds.
Dr. Sadia Benzaquin says with this cryobiopsy, he uses a tiny frozen scope to retrieve a good tissue sample from the lung. And he invented a technique to stop subsequent bleeding with another scope.
And immediately after you come out, you need to go with another scope to the same area that you biopsy to prevent the bleeding.
Anne-Marie's pulmonologist at Einstein, Dr. Mohammed Samid, says cryobiopsy is an important advance in diagnosing lung disease.
It causes lesser bleeding and it's lesser invasive as compared to opening your lung and taking a piece of it. It's a win for us, and in the long run, it leads to better outcomes.
With her diagnosis, Anne-Marie, who lives in Richboro, is now getting the treatment she needs.
I'm able to do more and more, which has been a blessing.
Thankful to have the technology of the tiny freezing tools that started her path to recovery. And doctors say cryobiopsies are just as good as surgical biopsies for diagnosing interstitial lung disease. Technology can be great,
Like
right?
Anne-Marie said, a
It really is,
blessing
yeah.
indeed. How about it? Steph, thanks so much. Appreciate it.